Latest war on drugs is not being fought on dark street corners and in back alleys. Millions of Americans are getting their fixes from pharmacies and medicine cabinets at home.
Every 19 minutes, a person dies from prescription drugs.
The number of women dying from overdoses in America is skyrocketing. More women die from overdoses on all drugs than die from car accidents.
Illicit drugs in the street are always going to be there, but now young people are going to their medicine cabinets and finding a new way to get high.
The United States has the highest per capita consumption of opioid painkillers. It also has the highest overdose death rates in the world. In the United States, there are about 100 drug overdose deaths a day. It's more deaths than from HIV/AIDS. It's more deaths than motor vehicle fatalities, more than firearm deaths. So it's a serious problem.
Pain control is a need, and anxiety medication is a need. This is good stuff. It's maybe overprescription, saturating the streets, and there's not an easy answer. I think certain things could be drug monitoring, making sure folks can't go to multiple doctors to get multiple drugs.
What we are seeing is when we come down in a criminal justice way on prescription drugs, when we sort of dry up the source, people turn to street drugs and to street heroin, and then they turn to injecting. And that leads us full circle back to where we were, except more people who were never involved in street drugs are now involved in street drugs. So any response that we have to prescription drugs has to take that into account and not to go back to restricting prescription drugs for pain, and not to go back to a place where we're punishing people for no reason. And we need to have access to adequate drug treatment. We've been dealing with heroin overdoses for decades and no one really cared. And now we have people experiencing overdoses from prescription drugs and people are taking notice. And because of the work that we've done on the ground with heroin users, we can begin to apply some of our lessons to prescription